internal intercostal muscle helps to decrease chest volumes for stranger expiration. Breathing pattern or inhalation pattern or respiration pattern quiet breathing. Diaphragm external intercostal muscle are the main muscle in aspiration under resting condition. Okay, contraction of the muscle increase chest volume, flattening the lungs. Expiration is the passive process without muscle contraction. A muscle of the rib cages augmentate the action of the diaphragm. In the deep breathing or deep respiration, in aspiration and expiration, both of them are active process with many muscle contraction. Amplitude of the intrapulmonary pressure changes is related to breathing frequency, extent, and unobstructed respiratory tract. For continuing the mechanical ventilation, we should know what's the compliance of the lungs. Compliance. The lung compliance is the changes lung volume for each unit changes in the transpulmonary pressure. The extent of the which lungs will expand for the each unit increase in the transpulmonary pressure is enough time to allow to reach equilibrium is called the lung compliance. The total compliance of both lungs together is the normal adult man averages about 200 milliliters of air per centimeter of the water transpulmonary pressure. That is, every time the transpulmonary pressure increase 1 centimeter of water, the lung volume after 10 to 20 seconds will expand 200 milliliters. Okay. The compliance depends of the following elastic forces. Elastic forces of the lung tissue are determined mainly by the elastin and collagen fibers. Another elastic forces caused by surface tension in the alveoli account for about 2/3 of the total elastic forces in normal lungs. Lung compliance shows with the CL. Definition: changes of the transpulmonary volume induced by changes in the intrapulmonary pressure. The compliance equilibrium, which is the ratio between delta V to delta P of transpulmonary pressure, TP. The alveolar pressure alveolar minus intrapleural pressure PIP is compliance is about is 0.2 liters per centimeter water or 12 to 100 milliliters. Okay, liters or milliliters. In the quiet inhalation of the breathing, the compliance is about this one, is 0.2 liters per centimeter water. Thoracic compliance as well, CT. CT compliance thoracic compliance change is in thoracic volumes to change in transpulmonary pressure. Intrapleural pressure minus atmospheric pressure of the outside chest wall. Thoracic compliance is about 0.2 liters per centimeter water. Lung thoracic compliance with together compliance lung with thoracic. Changes in the lung volume induced by the unit in transpulmonary pressure. Transpulmonary pressure PT equilibrium equal with alveolar pressure PIA minus chest surface pressure chest and this PCS. Normal value is together is 0.1 liters per centimeter or is 110 milliliters per centimeter of water. In this figure, you can see compliance diagram in the healthy person. This diagram shows changes in the lung volume during the changes in the intrapulmonary pressure, alveolar pressure minus pleural pressure. Okay, you can see the lung volume change is shows in this direction per liters, and pleural pressure shows in this direction. You can see after that the pleural pressure is changed, the volume will be changed, and after that is the reach to peak, and for the inspiration. For the expiration, the reverse and change the pressure, pleural pressure, and the volume is changed and will be decrease. Okay. This figure is very specific figures, and this lung filling with physiological saline induce lung expansion with a small pressure, and the whole lung filling requires lower pressure. This traces of the empty is not obvious after filling. Okay, in this figure. We have two compliance for one lungs and other lungs. Comparison between them. The pressure of filling lungs with air is much larger. For this lungs is air filled. This lung is saline filled. Okay, there is not air. These have air. These have not air. The pressure of filling with air is much, for example, larger than with physiological saline, about 3 times. Okay, you can see this is 3 times more than this one. Why reason? Filling with air makes a liquid air interface in the alveolar lining liquid and alveolar gas, then produce surface tension. Okay, this experimental is has been done in the cats and pressure volume curve in vitro. Okay, you can see comparison of the compliance diagram of the saline field in this here, saline field, and air-filled lungs when the alveolar pressure is maintained at the atmospheric pressure 0 centimeter of water, and the pleural pressure is changed in order to change the transpulmonary pressure. You can see in this figure we need to more force, and this figure we need to less force. You can see this is different with this. The compliance means ability of the lungs to stretch. The lung compliance is the fibrotic lungs and the other restrictive lungs disease, and when not enough surfactant. Elasticity, elastance, ability to return to original shape, low elasticity in case of the emphysema due to destruction of the elastic fibers, and the normal lines is both compliant and elastic. You can see the volume in this direction and the standing pressure in this direction as normal lungs, and the fibrosis lungs and the compliance is decreased. In the emphysema, the compliance will be increased in comparison with the normal conditions. What's the means of the surface tension? Okay, water molecules are attracted to one another. You can see the water surface lining the alveolar attempts to contract as the water molecule pull toward another. This attempts to force air out of the alveoli, causing the alveoli to attempt to collapse. The net effect is to cause an elastic contractile force of the entire lungs, called the surface tension elastic force. For example, you can see draft water, okay, and the unequal attraction produce tension at the liquid surface. It's the same in the alveoli uh, alveoli of the lungs, alveolus of lungs. Therefore, in the lungs we have a surface tension because of the water and air. The principles of this, principles of the surface tension. When water forms a surface with air, the water molecules of the surface of the water have especially a stronger attraction for one another. As a result, the water surface is always attempting to contract. This is what holds raindrops together. That is, there is a tight contractile membrane of the water molecules around the entire surface of the raindrop. Now, let us reverse these principles and see what happens on the inner surface of the alveoli. Alveoli or alveolus. Here, the water surface is also attempting to contract. This results in an attempt to force that air out of the alveoli through the bronchi, and in doing so causes the alveoli to try to collapse. The net effect of is to cause an elastic contractile force of the entire lungs, which is called the surface tension elastic force. Surface tension elastic force. Smaller alveoli have a greater tendency to collapse. Okay, denote from the following formula, law of the Laplace, that the collapse pressure generated in the alveoli is inversely related to the radius of the alveolus. This means that the smaller alveolus, the greater is the collapse pressure. The pressure is equal to 2 times surface tension to the radius, and this law of Laplace shows the P equilibrium with 2 times tension divided to radius. The P shows stand for additional pressure, retractive pressure produced by alveolar surface tension. Okay, and the T represents surface tension, and R shows radius or curvature. Okay, in the, for example, in this the tension is very high, and pressure will be high, and this causes direction of the airflow from this one to this one, and according to this relationship and formula. Okay.